Missed that.
As we're getting started.
Well, that worked. Well, thank you all for joining us this morning. For those who I don't know, I'm Ray Pucci. I'm president here at the Delaware County Chamber. And before I introduce the team from Biomobility, let me just tell you a little bit about what got us to this point. Our friends at Rural Health Network, the Get There folks, asked us, almost a couple years ago now, to look at not only help promote the Get There program and the transportation services, but to really take a hard look at transportation and what transportation options might exist here in Delaware County. So one of the things that the chamber did is we put together a steering committee of about 25, 26 people that included representatives from county government, that included some of our state agencies. So we had New York State Department of Transportation involved in that process. We had some national transportation consulting people like Bill Wagner, who's here on the call with us this morning, large employers, private transportation providers here in the county. But we had healthcare, human services. Dottie, have I missed anybody? Quite a group. And we've started having that conversation, looking at what we can do for transportation options here in Delaware County. As we're all painfully aware, Delaware County is one of the very few counties in New York State that has no public transportation options. And as we were going through this, we realized, and we were updating the county's coordinated transportation plan. One of the things that we realized very early on is, as we were preparing this plan and looking at this and feeling the weight of the 1,500 square miles falling on our shoulders, how are we going to do this? We realized we needed some, as I say, professional help. And thanks to Wayne Marshfield and others on the review committee for the American Rescue Act funding that came in, the county agreed to hire Biomobility to really take a look at transportation options in this rural area. I'll let these gentlemen talk a little bit more about what Biomobility is and the work that they've done quite literally around the world. So I'm going to turn the program over to Dan Berkovitz and Webb Faribault, who have been working on this project now since October.
July, yeah. I just looked it up. 10 months.
It's been a several month project. They've been awesome. And we've gotten terrific response from the public, from residents here in Delaware County. But Webb and Dan are going to talk about that. And then after their presentation, we're going to talk about some next steps. So Dan, Webb.
Great. Thanks for kicking us off. Thanks, Ray. So yeah, nice to meet all of you. My name is Dan Berkovitz. I'm a vice president at VIA Mobility, and I lead the VIA Strategies team, which is our dedicated transportation planning and consulting team. As Ray mentioned, VIA is essentially a transportation strategy and innovation company. And so we develop different types of solutions for transit and mobility for different communities all across the world. We have a presence all across North America and in Europe, Australia, New Zealand, many different places. Our strategies team, which is our planning team, has had the opportunity to do planning studies in dozens and dozens of different places, again, across the Northeast and the US, but also elsewhere in the world. And what knits together many of those places is that they're areas that are traditionally are hard to serve, with traditional public transit. So they may be lower density, they may be more rural in character. And so while lots of those places may be far away from Delaware County, and many of them share some key similarities. And so we were excited about the opportunity to come and work here with Ray and everyone in the community. I'm just going to give a brief introduction to the project, and then my colleague Webb, who actually served as the project manager and has been very involved over the last like 10 months, will share some detail on our work and what we've discovered and the recommendations that we're making. So Webb, I think you could just go ahead to the next slide. So just by way of introduction, our understanding of the goals of this project, as Ray essentially just outlined, were to understand the value that a public transit system of some kind might potentially bring to Delaware County. And so in order to evaluate the feasibility and the costs and the benefits of different alternatives, we started out by really working to understand the extent and the nature of transit need and demand in Delaware County. So looking at demographics and socioeconomic characteristics, but also really by talking to people. So Webb will share more information, but we did a survey, which was ultimately one of the largest surveys that we've done anywhere, with a tremendous response rate here in Delaware County. We had a great steering committee, which Ray mentioned, that we engaged with, and we did a number of stakeholder interviews as well. So we've really worked to understand the community's needs, looked at the existing transportation options, evaluated where maybe they've been working well and where there may still be some needs and gaps, developed a number of different alternatives that fell into essentially 3 to 4 categories. So fixed routes, deviated fixed routes, and then 2 different types of demand responsive mobility. So dynamic demand responsive mobility and pre-scheduled on demand mobility as well. Assess the cost and benefits of those different options, and provided a framework that hopefully will lead you to some next steps in the future. Next slide, please, Webb. So just to give you a sense of where we are today, I mean, essentially at the end of the process, at least the end of the beginning of the process, the end of the planning process, and the beginning perhaps of some exciting next steps. And so what we've done to date is an existing conditions analysis, and Webb will go into greater detail about each one of these steps, but that looked at those needs. We initiated around the same time this stakeholder and public engagement process that consisted of regular meetings with the steering committee, interviews with key stakeholders, and this public survey, and that kind of continued throughout. Between that existing conditions analysis and that public engagement, we developed an understanding of needs and used that to scope a number of different service alternatives that fell into those different modal categories that I described a few minutes ago. We designed those alternatives, we simulated and modeled them to understand how they would perform, how they would meet the demand that exists in the county, and essentially what it would cost to meet that demand in different ways. And on the basis of that, we again have developed a framework that hopefully can be used to decide on some potential next steps. And with that, I'll turn it over to Webb, who served as the project manager, and we'll walk through each one of those steps and the outcomes in detail. So thank you.
Thanks. All right, yeah, so I will talk through in more detail the process we followed for these tasks. So starting out with our existing conditions analysis, if we go to the next slide. So just for some framing, at the outset of this study, we did decide to focus on Delaware County proper and also locations close to Delaware County. So you can see kind of the key travel centers we've mapped here. And these are based on work that the county government did in its 2022 coordinated transportation plan. So we really focused on finding ways to improve access to and from locations that are mapped here. One thing to note is that we do understand that residents have longer distance travel needs to places like Binghamton and to even Albany for medical needs. But at the beginning of the study, we did decide to focus a little bit more locally, really thinking about ways to improve mobility within Delaware County and in areas like immediately adjacent to the county. So Oneonta as well was part of what we considered. As part of this process, we took a look at demographics in the county using publicly available census data. So these, I think, are findings that will be familiar to everyone in this room. But we learned that the county has a rural population, which has demographic traits that are usually associated with a high need for transportation assistance. So the population is older than average for New York State. It also has higher rates of disability and poverty. And these are factors we know are associated with transit ridership and a need for transportation assistance. And one thing we also wanted to note here is that the county's population is projected to get older over time. So based on information from the Cornell Demographics Center, we learned that the county's population is projected to decrease slightly overall, and that seniors will come to be a larger share of that overall population. One thing that we did want to note here also, despite the fact that the county is quite rural in character, About half of the county's residents do live in areas with a population over like 500 residents. So there is some degree of concentration of residents in towns, and that kind of helped our planning because there are some concentrated centers of demand. So as Ray and Dan mentioned, part of this project was surveying existing transportation options and also having conversations with some organizations which are experienced providing transportation in the county. So here's an overview of just the categories of options that we looked at. So I think the biggest with the most trip volume and the most number of organizations was non-emergency medical transportation, which help residents access healthcare, and these are trips that are typically funded by Medicaid. We also looked at other human services transportation organizations. So these are typically nonprofits that help meet other transportation needs. We engaged with private transportation firms. We had participation from the Veteran Services organization. And then we also had conversations with a couple of adjacent transit providers. So Otsego Express is the county transportation provider for Otsego County. They are separate from Oneonta's city public transportation service. So they do something that is similar to what Delaware County might consider doing. And Otsego Express does currently provide a route into Sydney, though it's a little bit difficult for residents to access that route. And then we also looked at the private transportation options that exist in the area. And here the organizations that are bolded are who we could tell from our conversations, kind of the largest and most experienced providers of transportation assistance. And we were able to have conversations with each of these organizations through this study. So I'll now provide just an overview of the stakeholder input we've received through this project. And as Ray and Dan were mentioning, we did this in 3 primary ways. So we formed a stakeholder advisory committee, which has provided guidance throughout the study. I see at least a couple of members of the stakeholder advisory committee in this meeting. Thanks for being here. I think a couple more are virtual. We had virtual meetings throughout the project, and we were last here in person in September, kind of at the beginning, to do some framing activities and goal setting for the study. We also selected a number of organizations to have detailed interviews with. And here we really focused on organizations who had experience providing transportation, either in Delaware County or in a similar environment. And then as we've been discussing, we also had a pretty successful public survey where we learned more from potential customers of this service, what they would like to see. And I think that we learned a lot through these activities, but the kind of key point is that everyone who we spoke with really emphasized a need for public transportation in the county. So here's just to give credit to a lot of the participants who we appreciated working with as part of this study. So we had local agency partners, which included the Delaware County government, the Office of Aging, and the Office of Veterans Affairs. We spoke with a lot of service providers, including UHS Delaware Valley Hospital, Delaware Opportunities, Get There, Deposit Foundation. And we also appreciated participation from advisor organizations, mainly from the New York State DOT, who has helped us a lot through this process. And has provided some useful information about how the county can move forward with these recommendations. Also, again, Otsego County, who provide a similar service already, as well as the National Center for Mobility Management, and of course, the County Chamber of Commerce, which has been leading this study. So here's a summary of the findings from our public survey. So again, we had a really strong response here with 450 total respondents from the county, with just over 2/3 of respondents reporting that they would use public transportation if it were available. So I think that's a pretty impressive result and just an indication of the demand that exists for some kind of assistance. And one other thing to note is that most of these respondents who said they would use public transportation don't have previous experience using transportation assistance through any of the organizations that we mentioned a minute ago. And then we also surveyed the public to learn where they would want to travel to and from. And I think it's probably not surprising that the top travel destinations are the largest cities in the area. So the highest number of responses was for Oneonta, followed by Delhi and Walton. And then you can see Binghamton and other destinations in the county having slightly lower responses. So this was really useful in just helping us understand where people would want to go to and from using public transit. And then one thing to note is that the response we got here was overwhelmingly positive. I think that almost everyone who responded really did express or affirmed our understanding that there is a need for public transportation. But we did want to note that a few respondents did express sentiments against providing public transportation. So it's not, I guess, a unanimous feeling in the county that this is something the county government should do, and that we would expect some people to be opposed to this idea. In our experience as consultants, this is something we see in a lot of places. So I think definitely not uncommon, but we did just want to note that. So to get into specific transit service options, I'll first kind of give an introduction to the service categories that we looked at, which, as Dan mentioned, are fixed route, on-demand transit, and deviated fixed route. And then I'll talk through how we investigated each of these options and present some of the results that we found through our work. So here's just a little bit more detail on the types of service that we looked at. So I think everyone is probably familiar with a fixed route bus. This is a kind of traditional bus service which has a fixed route. It would have a published schedule with specific stops. And we generally looked at fixed route service as a way to connect towns that were a far distance from each other. This is a pretty efficient way to provide longer distance trips across the county. So we'll get into some of the specific fixed routes that we looked at in a moment, but that's one category of service. The next category of service we looked at, which here we called kind of a hybrid bus or a hybrid bus and microtransit service, functions a little bit like a deviated fixed route, if anyone is familiar with that service category. Here, the idea is that it's a flexible service where customers would make a reservation to be picked up, probably at their home or wherever they're traveling from, and the vehicle would spend time deviating within a town to pick up several people before then making a scheduled trip to a nearby town and dropping those people off at their end destination. So if anyone is familiar with the county's senior bus service, that bus service functions on a kind of similar model where a vehicle is scheduled to make a run on a given day. We'll spend kind of the morning picking people up, the afternoon dropping people off, and then taking them back to their destination. That's what we were thinking about with this type of service. And then microtransit, I think, is probably the newest type of service. And this is something that transit providers have been introducing around the country in recent years. This is an on-demand service that uses technology in some way to try to group customers traveling in similar directions. And it's also a reservation-based service. So typically a microtransit service will have a zone like the one pictured here, which includes Margaretville and Fleischmann's, and would make pickups and drop-offs within that zone. So we looked at microtransit as an option for kind of smaller areas where people are more likely to have a need for local trips rather than for these longer distance trips between towns. And I think we do have a little bit more information on the relative strengths and weaknesses of these service options on the next slide. Or first, we have an introduction to microtransit, which is a new service category. So I think part of what we hoped to bring to this project is thinking about ways we can use new technologies to better serve geographic areas that have been really hard to serve with public transportation historically. So we know that Delaware County, just because, as Ray was describing, is really large, it's been a very hard area to plan public transportation for. But microtransit service provides a way to cover large areas or to cover specific smaller areas of concentrated demand in a more efficient way than might have been possible previously. So the way this technology works is that for anyone who's familiar with like an Uber or a Lyft app, it can function kind of similarly for customers who have access to a smartphone, or customers who don't have a smartphone could call a dispatcher to make a trip reservation. So the system accepts reservations with pickup and drop-off addresses, there's a fleet of vehicles that kind of roam the zone. So they don't have a planned route or a planned schedule, and they respond to demand as it comes in. So they respond to trip requests. Typically, these services have a wait time between 15 and 30 minutes. So that's either a customer who's called a day in advance and said, hey, I would like to travel at this time. Typically, the system would say, okay, we will pick you up within 30 minutes of the time that you've requested. Or some systems have a more dynamic model where rather than pre-scheduling, a customer calls at the time they want to travel, and the system would say, okay, we will come to pick you up in 15 to 30 minutes. One aspect of these types of services is that customers are sometimes asked to walk to a nearby corner to meet their vehicle. This can help vehicles aggregate more customers in a single trip by asking people basically to walk to meet the vehicle along a similar route that it's already following. And that is in the service of trying to create as many shared rides as possible. Here, the goal is really to pool as many customers as possible traveling in a similar direction. So we looked at these service options and wanted to attach them to specific services in Delaware County, which we then modeled out and attached costs to. So as I mentioned, we looked at fixed route buses as an option for longer distance service. And here the two routes that we looked at were a route beginning in Walton, providing service to Delhi, and then also providing service to Oneonta. And then we also looked at a corridor beginning in Hancock, further south, providing service to Deposit, and then Walton and Delhi. Here, we tried to look at the most populated corridors in the county, both of which include Walton and Delhi. And these are the two specific options we decided to model, but we did want to note that we think these options can be illustrative of other routes. One could be Hancock, Deposit, and Sydney. Another could be Sydney to Oneonta. We think that the information regarding these two will be useful in thinking about other fixed routes as well. For the hybrid services, and these are ones that provide a scheduled run between two towns, we looked at the town pairs of Delhi and Oneonta, of Margaretville and Delhi, and Walton and Delhi, which we think, again, are illustrative of other town pairs that the county might consider as it moves forward with these recommendations. And here we selected these because they're three kind of different pairings, and we wanted to include a good variety. And then for the microtransit services, we looked at two options, which really would work together to provide service for the entire county. So this would be available to any resident, regardless of where they live. And we segmented that into a service that looked at the North County and a service that looked at the southern portion of the county. And then we looked at smaller on-demand services. So these are the ones where you call to book a trip at the time you need to travel, in a corridor between Walton and Delhi, and in a smaller zone, including Margaretville and Fleischmann's. So maybe we can just leave this up for a moment for people to look at what these services would look like on a map. So we selected alternatives really to try to get a wide geographic spread, and to make sure that we were considering what it would mean to provide public transportation in most corners of the county. So you can see the fixed routes we looked at kind of do a long distance, more or less north to south spine through the county. The hybrid services all connect to Delhi, which we think is probably the most important travel center to focus on, and then include destinations that are further from the county. And you can imagine if there were more routes, kind of spokes to other towns out that would also be connected to Delhi. And then for the microtransit services, which again are more zone than route based, the two kind of small green and orange would be the on-demand microtransit services, and then the dark and light blue would be pre-scheduled services for the general public living anywhere in the county. So I'll now talk through how we investigated these specifically, and then we will present our findings from this work. So we've already covered the existing conditions analysis. So we learned a lot from looking at data and also from conversations with stakeholders and from the public survey, basically what demand existed for transportation assistance. And then using that information and then also looking at similar public transportation services in New York and also elsewhere in the country, we came up with demand estimates for each of these services. So we tried to estimate the number of customers we would expect to take that service. We then used our firm's technologies, which includes a simulation tool that helps us simulate an on-demand service and a fixed route planning tool to understand more specifically what resources would be needed to provide these services. So these help us answer questions like how many vehicles would we need to meet demand, or what does this service look like from a customer's perspective? So how long do they have to wait? What is the trip duration, et cetera? And we did that in a process where we would run a simulation, look at the results, think of adjustments to service that might make it better or more efficient, and then perform additional simulations. So that's just some information on the process that we followed to develop results. And this process really helps us think through trade-offs that are inherent to transportation planning. So I think one of the themes that we discussed a lot in this project is just that the scale of Delaware County makes it really difficult to provide a high level of service to all locations. So kind of inherent to planning in a geography like this will be some consideration of trade-offs. So the things we thought about here were the relationship between customer experience. So that's kind of like availability and these factors, including walking distance, wait time, et cetera, and cost, which is kind of captured by the supply category here. And some of the factors that influence that are service area. So of course, when we look at larger service areas, that typically would mean a higher cost service. And then we also looked at some levers for demand and thinking about how services could be designed to attract customers. So this is just to say that we have tried to develop recommendations that kind of meet these trade-offs or navigate these trade-offs in a way that would provide the most useful service, but that there are trade-offs in planning. And here, this is just to, again, kind of flash what these look like before we get into the results. So here's a little bit more information on our demand estimate methodology. So we started out by looking at the population of the zone. So for each of those routes or service areas, we looked at the number of people living and working in the zone and also looked at demographic characteristics of those zones that are associated with transit ridership. And we used that to develop a capture rate, which is an estimate for the percent of population who would be covered, who would actually then use that service. And we used that to estimate daily demand. So here are estimates for the services with our annual ridership estimate. And we do typically provide estimates in a range, but these are our medium estimates, which we think is the most likely outcome. So a couple of things to point out here. I think you'll see that the North County and South County services, which are the pre-scheduled microtransit services that cover everyone living in the county, of course, have the highest ridership estimate just because there would be the most number of people who are eligible for this service. One thing driving demand there as well is that this is would be an open trip model where customers could use these trips to travel kind of to and from anywhere. And generally, the more places it's possible for people to travel, the more people who are likely to use that service. So then when we start looking at the hybrid and fixed route services, which are slightly less flexible, and because they follow a route, there's fewer options for where those people might travel, and also fewer people perhaps like living immediately on a corridor where they could walk to a stop. We see significantly lower ridership estimates. So around like 3,000 annual trips compared to 12 and 13,000 annual trips with the microtransit service. And then one other outlier I think to note here is that in the Margaretville service, just because the population of Margaretville is quite small, we would anticipate a relatively small number of trips for that service as well. And that's really just a function of the town's population. But I think what we tried to demonstrate here is really just a wide range of different investments that the county might make in transportation so that we can start thinking more specifically about which of these services should actually be implemented. So these are our demand estimates.
Webb, Sure. Back to that, if I can just interject something, the numbers that you're working with, the population is based on census data.
That's correct.
So that does not take into account non-resident homeowners, visitors, students, things like that.
Yeah, thank you. I think that's an important point. And we have tried to capture that a little bit here by looking at comparable services. So there's like two factors in developing these estimates. One is the like census population, and then another is looking at similar services that would hopefully help us consider some of those trips that you're mentioning. So here is a lot of numbers that basically shows what we learned through our simulation and modeling process. So once we had our ridership estimates, the next question was how many vehicle hours would be needed to provide this service? And you can see that in the next column. And then using that vehicle hour estimate, we also estimated annual cost. And then we essentially divide that cost by the expected ridership to understand what the average cost per passenger would be. And you can see here that these costs, of course, there's quite a range here. I think one like very important thing to note before we move on is that this is the estimated operating cost. So this is the cost of delivering service, but not necessarily of procuring vehicles or getting set up to provide service. But one really important thing here is that this is the total cost, but this is not necessarily the cost to Delaware County, because there is, as we'll get into in a minute, a lot of federal and also New York State funding available to provide these services that would actually cover likely the majority of these costs. So this is the total sum, but not the amount that Delaware County would actually need to contribute. Looking at, just cost per trips, I mean, I think to comment on the high cost per trips in the North and South County scenarios, I think that the cost per trips here are really just a function of the length of these trips. So with an open trip model where customers can travel really long distances, they're likely to be in a vehicle for quite a while. So that cost is basically just compensating a driver for a lot of their time. And we do see typically a little bit less passenger aggregation in these models, just because it's a lot more dispersed and demand is going in different directions compared to lower cost per trip on corridors of more concentrated demand. So we, based on these results, have developed a set of recommendations. And there's a couple of key findings that we would like to emphasize here. So as I mentioned, we think there's an opportunity to finance most of this service using money from the federal government and also from New York State. And we think that Delaware County can cover around 85% of its costs using these funding sources. That being said, the county will be expected to provide a local match, which based on these figures, you can kind of estimate. And that local match could come from the county's budget, but it could also come from kind of alternative or non-traditional sources like local businesses or foundations who might have an interest in promoting transportation in the county. And one thing to note here is that a small percentage of costs might be recovered by charging fares. But typically in services of this nature, we wouldn't expect that revenue from fares would be a large part of financing these services, which are typically mainly funded by state and federal government with a small local contribution.
That's a good question.
Sure.
Is that funding from the state and federal government, is that like ongoing, or is that like a startup and then they leave?
So there's a couple of different programs and there are startup funding sources available to kind of procure vehicles and get set up to provide transportation. This is about the ongoing costs. So this would be on an ongoing basis, right?
Thank you.
Sure. One thing that we considered in this study was the question of who should provide this service. So over the course of our conversations, we considered a couple of different options. One would be cities providing transportation. One could be nonprofits providing transportation. But it became clear to us both through conversations in the community and also through conversations with the State Department of Transportation that the county government here is the best positioned organization to play this role. Just considering the fact that a lot of the travel needs span towns, this is something that we do think should be coordinated at a county level. And because the county is the best positioned organization to play that role, we do think that making a service like this happen will require strong supporters working in county government, and also an ongoing commitment to provide administrative and personnel resources to manage the transportation service. And I actually would say that based on conversations again with the New York Department of Transportation, this is probably our key recommendation, that this is something the county would really need to adopt and pursue. In terms of specific service plans, we think that probably the hybrid service model, which is most similar to a transportation option which already exists in the county, which is the senior bus, is probably the best starting point, because it strikes a balance between being a personalized service where people can make reservations and it would pick them up at their doors, but also using some aspects of scheduling to try to get as many customers and vehicles as possible when traveling between towns. And once those services are in place, which we think would be a really good and promising starting point for public transportation, we think that the countywide options that would ensure some level of coverage for all residents of the county could be a good second step to pursue. Here is a little bit more specific information on what specific service plans could look like. So if we are considering a hybrid route which provides service between two towns, rather than doing a single pairing of two towns on every day of the week, it would probably make sense for the county to consider some kind of rotating schedule, which again is similar to how the senior bus is currently scheduled, where the bus would basically do something different on different days of the week. That would be publicized to customers, and customers would have the option to reserve trips on that service in advance. So this is kind of illustrative and would depend on the amount of money that's available. But if one vehicle were available to provide this service, we would recommend focusing on the cities of Delhi and Walton, and rotating the paired town throughout the week. And if two vehicles were available, we would then again recommend focusing on Walton and Delhi, but perhaps also introducing some service to Oneonta, understanding that customers have a high need for travel to that destination outside of the county. And this is just to note that the annual operating cost for a single vehicle service, we think would be around $180,000. So you can kind of think through the amount of funding that's available, the number of vehicles you have available, and the number of town pairs you could serve on any given day. And then again, this is just kind of noting that once these services are in place, we do think it's important to start thinking about how to provide coverage for residents who wouldn't be captured in these town-based zones.
Well, the estimate there for the annual operating cost for a single vehicle, is that going back to, again, pretty much the fuel and staff time, or is that?
Right, so this is based on an hourly rate that includes all aspects of the cost, I guess. So vehicle holding costs, fuel, labor, I think are the key kind of categories of that cost. But yeah, that's a fully burdened rate. So that is kind of it in terms of our presentation. And this is the information that we have delivered to Ray. But Ray, I don't know if you want to offer some.
I will, but I want to offer the folks who are joining us online, if there are any questions, put them in, or comments, put them in the meeting chat area before we get to next steps, or if anyone here has any questions, other questions or comments.
Looks like there are a few comments in the chat.
Those are my comments.
Okay.
I have a question on this recommendation to get started. In your experience with other places, and maybe it's subjective, you can't even answer it, but how long does it take to get it built up? Like,
That's a great question. I mean, I think when we develop our ridership estimates, those we think apply to a service that's about, a year old. So we don't expect that that ridership would be day one. It does typically take a fair amount of time for the public to learn that this service is available, Also to start incorporating that into their travel plans to get familiar with it. So it does typically take, a few months at least for a service like this to mature.
Bill Wagner has a question. Is there any indication that Delaware County, I presume he means Delaware County government, wants to be the lead in this effort?
So maybe I could just offer a few memories from our conversations with individuals in government. So we had great support from the Office of Aging, which again is currently providing a transportation service through the county. And that office did express kind of an openness to thinking about expanding that operation to work for the general public. But I think that one of the big things that we've been hearing from the county is just a lack of personnel and an idea that there's really not a person working in government currently whose responsibility this is. So we do think that additional personnel would really be able to help the county pursue these recommendations. But beyond that, which is just based on our conversation from the senior office, I would probably defer to Ray or others in this room.
Well, I sat on the Office of the Aging Committee.
Mhm.
And the senior council bought that bus.
Mhm.
No funding came out of the county
Mhm.
for that bus. And they tried different routes to different places.
Mhm.
And they constantly look at the rider participation, and they'll alter because participation down to certain places
Mhm.
are very low.
Mhm.
And so they kind of have it down, and it even relates to the day of the week.
Yeah. Yeah.
There's a lot that goes into it. And but I guess one thing that caught my eye was this travel destination.
Mhm.
And that survey for the destination seemed to follow all the way through this. I thought an important part of that survey, another chart would have been, where did the survey respondents come from?
Mhm.
I was a little bit surprised that Delhi was almost as high as Oneonta.
Mhm.
And Sydney was the least. Sydney's the largest village in the county,
Mhm.
but yes, they're on one end of the county. But I thought an important piece of data would have been, where did the respondents come from?
Mhm.
Did 60% of them come from Delhi?
Or maybe from Sydney, because
Sydney.
they don't need to travel to Sydney. Yeah.
So I think that's a great point. And we didn't, we asked about travel patterns and where trips were likely to originate and end. But we didn't collect, I guess, specific location data with those responses. So I do think, and this is, a little bit captured in the service plan we proposed where the bus would rotate between town pairings. But I do think, as you're pointing out, there's probably another step of conversations to have, thinking about what is actually the best town to serve with that bus when it's available. Where do we think? And I will say, we did have a pretty good response here of 450 residents. We don't know exactly where they reside, but that is a pretty large sample. But I think totally to your point, we would recommend, considering
From a Chamber of Commerce point of view,
Mhm.
we'd like to see the ridership remain in Delaware County.
Yeah.
Not take them to Otsego County, but.
That's why there isn't a
that's
bus
where-
to Binghamton.
Pardon?
That's why there's no bus to Binghamton or Kingston.
Wayne, is the bus at capacity?
No, it's
I
not.
mean, I guess that's my thing too. I mean, largely this is going to serve elderly populations and those of an income level that don't have their own vehicles, correct?
So yeah, I think one comment on that, and this wasn't included in the recommendations here, but we will be also providing a more detailed final report, which provides a lot more information on our conversations and also the processes we followed, which considers the senior service a little bit more. And based on the conversations we had, it seems like that service is actually quite successful and is really important for a lot of its customers. So we would not recommend replacing that service. And as Wayne, you mentioned, it's funded separately than the funding sources we would recommend using for this. So those two services wouldn't necessarily be competing for budget other than the small county contribution. And I think the two programs would be pretty differentiated in that the senior bus might provide, service to a town like 1 day a month. So there are seniors who are planning really far in advance to make that their shopping day. And I think the goal with a public transportation service of this nature is to provide something hopefully a little bit more regular, a little bit more available, which seniors could also use, but that would hopefully also appeal to a new ridership cohort.
And originally, the goal of the project, and thank you, and the reason that the chamber is involved and remains involved is not so much because of the seniors, but because of it. We see transportation as a workforce issue.
Okay.
And when we have 31% of households in Delaware County with only one vehicle, when one spouse goes with the vehicle, the other spouse, what am I doing? And granted, this may be a smaller subset, but we have a sizable portion of our population who don't have access to a vehicle for whatever reason, be it if they're in recovery, whatever the case may be. And employment is a huge part of their recovery efforts. So those were two populations that really came to the top of the stack. And what and I should frame this, what we're discussing here doesn't replace what is already veterans are doing, senior OFA, Office for the Aging, is doing, but rather supplement it and make that more available for more people. We got a couple other questions here. One from Bill Wagner. You have not mentioned frequency. How does any of these models prevent long waits for healthcare appointments? And Nick, maybe that's something that, there are already services there through the Get There program. And again, this supplements what's happening,
Right.
or they supplement each other.
It sounds like this is still, we're not at the service planning component yet. We're still at the kind of conceptual, this is what it might look like, but that is a question that would have to be dealt with the farther along you get in terms of, the scheduling with the days per week. Is it gonna go multiple times per day? Is it gonna be once in the morning, once in the afternoon? So those questions exist certainly. So there's still more work to be done, I think, in terms of thinking about not just the large picture of how you want the service to look, but what are the gritty details of it?
I do think that healthcare, to a certain extent, could try to schedule around a transportation schedule when it's necessary for a patient. But not always, because obviously we don't know what's going to happen to people. But I mean, if they're coming for a physical or a standard doctor's appointment, that's probably something that could be doable. It's going to take some work to do that. But in healthcare piece, my big concern is getting people who do not have access to transportation, but are also not Medicaid, on Medicaid, finding them a reasonably priced way of being able to get around, and not just for healthcare, for anything, because they're no longer serving Delaware County in that capacity, but one place, it was like $120 to go from Roscoe to Walton one way.
Yeah.
Nobody can afford that.
Yeah.
So that was a huge piece for me, that somehow we would like to all, and not just for me, I mean, for all of us to try to.
I think that's an important thing also. I think what's it has to be remembered here with not just Delaware County, but any county that is investing in transportation, a public transportation system. The service that we're building isn't gonna solve the need for everyone, and it can't solve the need for everyone. You're building a good, strong piece to be a foundation of the transportation network here, and then you're gonna have to help build the other pieces as well, the senior buses, the veteran services, what Get There can offer. You know, it's gonna have to work in kind of especially in a rural county, you're gonna have to work all together. Coordinating services is how we've called it in the mobility management world. So all the service providers, Delaware Opportunities, the private entities, you know, have to work together around the piece that we build here. So just to keep that's kind of the overarching thing, I think.
Yeah, and I think, I mean, that's a great point. I think to build on that, you know, there was a bit of conversation about the need for, you know, potentially a champion at the county and, you know, how the county might potentially take this on. And, you know, mobility management is certainly a concept that's been employed very successfully elsewhere in the country. And, you know, ultimately solving sort of mobility problems for as many people as possible in the county, you know, even if you were to, as you were sort of pointing out, introduce some kind of public general purpose public transportation system, would probably require leveraging these different programs. And you know, that is something that somebody who is managing a public transportation program could also potentially assist with, depending on how that's implemented. I think just to, you know, to close the loop on, it was Bill, I think his question, you know, I think this was also pointed out, this was more of a strategic planning effort than a service planning effort. So, you know, we don't have specific frequencies worked out or anything like that for these options at this point. I think that's something that would have to happen, you know, if certain options were selected. But I think, you know, implicit in that comment, I think, was an observation about what are likely to be pretty low frequencies and the challenges that can bring. And that's certainly the case. I mean, I think as Webb was suggesting, you know, at least initially, you know, we're looking at potentially one vehicle services, serving origin and destination pairs, you know, less than every day, right? So that might be, you know, multiple trips a day, I think, you know, but again, it's limited by the number of trips that a single vehicle can make. And you know, there is this concept, you know, in denser areas, you'd ideally like to see more frequent service because people don't have to plan around the service as much, and that's great. But you know, in looking at the density and the populations in some of these areas that we were considering serving here, you know, unless you were to take on extremely high costs per trip, you know, it's challenging to provide frequencies greater than what we're looking at here. And so they are services that people would have to plan around. But hopefully, you know, that they could plan around with the knowledge that there would be options more frequently than there are now, if there are options at all.
The other thing that I didn't see, and maybe I missed it, I don't know, the size of the vehicles. Did you do anything regarding that? No.
Yeah, so we had some conversation with, so I guess first, like, we think that the majority of these services, other than the on-demand services, could probably be delivered with relatively small, perhaps minivan sized vehicles. And then when we start to look more at the fixed route options, so that would be the town pairings or the longer distance routes, we would probably recommend a larger vehicle for that, which might be a Sprinter with a capacity of 15 for these kind of hybrid services, or maybe, you know, a larger transit bus for the long distance fixed routes. But based on conversations we had with the OFA, which
that's state DOT, right?
Oh yeah, state DOT. So there's a so the state DOT has some specific funding requirements about which types of vehicles are eligible for New York funding. Typically, those vehicles should have a passenger capacity of 15 or higher, but it's possible to apply for a waiver for services where that size vehicle doesn't seem necessary. And I was going to add, just based on conversations with OFA, I think they use a bus with a capacity of 15, and they do sometimes actually hit that capacity. So I do think some of these services would require a larger vehicle.
So you go over a certain size, then your CDL driver is
Yeah.
different.
Which makes it, yeah.
Trying to get CDL drivers today is
Trying to get somebody to show up every day.
right.
Yeah.
But we had a social services meeting yesterday and there was a discussion, right, Elizabeth? On being able to get recipients into jobs and stuff, you know, where we need to send a car, maybe to Hancock, pick somebody up and our goal is to get them back into the mainstream of society and working. And so that's a tremendous need from social services, but nobody ever contacted social services for this information.
Yeah, they've been involved.
Well,
They've been contacted.
The
through this
commissioner and
process.
the deputy spoke otherwise
Well,
yesterday.
I have email trails.
But anyway, there's a tremendous need of going to get a client and
Mhm.
take them somewhere, whether it's to a job interview or wherever, and it's a big issue with the department.
I mean, I think at its onset, I think at its onset, at least in Delaware County, it's largely is a social service. That's, I'm not saying there won't be other users, but I think the large majority of the users are going to be a specific population.
Yeah.
I think one benefit of a service that is not necessarily something that you can quantify right now is attracting young people into the county. Because I know right now, college students trying to get internships in the county can't get housing where the internships are.
There you go.
So they need transport or they need to buy their own vehicle. And a vast majority of our students on campus come from downstate and they don't even have driver's license. So they can't stay here to do their internships. They have to go elsewhere.
Yeah.
And if we're looking at a populace that's going to be a third seniors in the not too distant future, we need to look at things that could attract young people to come and stay.
And then were these buses, it was an idea about maybe making them handicap accessible. If so, that takes up seats. OFDA does it, and the hydraulic lifts and stuff are in the butt to keep going. But it's maybe a necessary item for.
Yeah, I think we would recommend that each of the vehicles for the service be wheelchair accessible.
That's why they didn't really look at maintenance, things like that, but
It takes up a couple seats
Sure.
to put one in and added expense thing, but it's pretty, it's a needed commodity for certain.
when I think if it's a public service, we probably would have to,
Right.
if that's the route it's going.
I do think, oh, I'm sorry, Wayne, go ahead.
No, that's good. I said, a lot goes into this.
It does, it's a whole lot of domino effect things, but I will say like over the years, because I've been working on this type of project probably 28, 30 years, 35, I don't know. Different communities have gotten together to do transportation within their community. I know the chamber tried to do it in Walton, Deposit Foundation was doing it in Deposit. I think Delhi had something at one point in time that I could think of in Sydney. And none of them that I think are doing things now. Deposit's just starting maybe a little bit again, but I do think if you had a core service, you might see some of that pop up again.
Yeah.
But it was just too difficult because you couldn't get them anywhere specific, so if there was a way for this to happen, I think that some of that other thing could augment some of this possibly.
I have a couple other comments, questions from the chat. One, and I don't know if this is maybe just a little off topic. Does anyone know if there are studies that have looked at how much longer older residents can remain in their homes with public transit support? I don't know if anyone here can really answer.
I would
speak
guess
to
that there's studies based on like the aging in place world. I wonder if AARP has looked at that in terms of, I'm not certain in terms of longevity, but maybe the economic benefit of keeping people active and available to participate in the community longer. I feel like that's something that probably exists.
I mean, I think we've seen that in a rural area, not just Delaware County, it's just the lifestyle, the way of living, it can be more difficult to stay older age, you're that much further from things, people burn wood, all a few things just like that.
And you can't find help. There's nothing to come in to, know, there's no caregivers to speak of, so.
And then that many less neighbors, you know, the thing that
Exactly.
every kind of works together to get by, there's that much less.
But I think the county's trying to keep them in their home.
Oh, of course.
Oh, I think so.
Delaware Opportunities running all over
Yeah.
creation, delivering meals.
Meals on wheels. yeah.
No, I think there is a concerted effort to do it,
Yeah,
but I think that there's nobody that wants to be caregivers. There's no people to go in and, you know, give the bath or help with the meal, you know, help with.
And we have that many less people, population wise, you know, it's,
Hard.
it is all tied together.
You know,
Just a comment here, the Delhi Walton hybrid route could also serve Camp Shankantuck, the 4-H camp for day campers as well as employees. Another question, at what level would the hybrid model be able to serve employment? Most employment is going to be more than 1 or 2 days per week. I think that goes back to, you know, that discussion of one day it could do this, another day it could do that, but that's something that,
Yeah,
just needs to be.
yeah, I think that, I mean,
fleshed out.
as you like, different types of services would attract different kinds of trips. And I think one that does not do every day of the week is probably less likely to attract a commuter.
And it is ultimately just a question of cost. I think, Webb had kind of sketched out what the likely annual cost for a kind of, an origin destination pair that runs with one vehicle, would be. And so, you could, in order to sort of offer some economical options, we began by showing kind of a 1 vehicle scenario or a 2 vehicle scenario that served a number of different village pairs. But, another option would be to say, well, we're just going to run between Delhi and Walton every day, or we're going to start with 3 vehicles and we're going to serve, 3 different routes essentially. That would just cost 3 times as much as starting with 1 vehicle. So,
Right.
I guess the other thing that, like, if you're running them Delhi Walton, how many trips per day? Do you think that is, if you're just doing 1 vehicle,
Yeah.
that route, I know you're going,
So here we've kind of tentatively sketched this out as actually only 1 round trip, just because
One
the
round
time spent picking people up,
yeah,
time traveling between towns, giving people a window to do their errands, perhaps go to a medical appointment, and then pick up and drop off again is likely a single trip.
The distance.
The distance, yeah.
Yeah.
And there are, a few hours there where after dropping everyone off at their destination, there's a vehicle that could, do something else, maybe provide a local service in the town that it's ended up in. But the distances make it hard to do more than 1 trip with a single
Exactly.
vehicle.
and then you've got a driver kind of. Doing nothing for a few hours while people are doing what they're doing in their destination, and then they're working again to. Take them back to wherever, whatever
They're
direction.
working that whole time, I have to think. As far as wage,
Oh, yeah, they're working, but they're not really.
they're not
They're
actively
kind
doing
of
it.
sitting,
Transportation,
like today
yeah.
when we did teddy bear clinic, the bus drivers were all sitting at the hospital.
Yeah.
You know, while we were doing teddy bear clinic, but they're
Mhm.
getting paid, obviously, but they're not actively driving. But, and Medicaid, you have to be actively driving, someone, a person, so, yeah, so.
but then we have many instances of vehicles that are needed to take people to behavioral health center.
Which I was surprised Walton wasn't higher, actually, because we do have that
Yeah.
up Walton.
Yeah.
So, I mean, Dell has the county seat, so that made sense to me. Walton has the behavioral health center, which is used a lot.
But
Sydney,
new, right?
but it's always been in Walton.
Yeah.
Yeah,
And then Sydney, I guess, didn't surprise me as much, Wayne, only because Kmart's closed now. You know, if Kmart were still open, Sydney would have risen up higher, I think, although Price Chopper's still there. So,
So just anecdotally, we get a lot of calls through the call center from people in Sydney who want to go other places, Oneonta, Bainbridge maybe. But we don't get a lot of people calling to go to Sydney. So it kind of maybe bears out to what they're saying. It's more of a, I think Walton might be this case too. It's a trip origin place that rather than a destination.
I have a couple other comments from folks in the meeting chat. And Dottie, maybe this is, I think you all are already doing some of this stuff. Could home visits or mobile medical care units from healthcare providers be part of the solution, bringing services to citizens or closer to citizens?
We do some home visits, but I think. I think there's some kind of a rule, and I don't know, probably there, that it has to be someone who's homebound. I'm not 100% sure of that, but certainly we are looking at different things that we could possibly do to make things easier. If they are homebound, like I can tell you, we'll send our lab people or our nurses out to draw the blood and things like that for people, but. If they're not on home care, but can't get out to the thing, so.
And one final comment from Charlie Piper over in Delaware County Veteran Services. It should be noted that the study was conducted because of the extreme need for some type of transportation for all Delaware County residents. Having a model that incorporates urban and rural communities is difficult. We need to keep flexibility in mind for a solution. Good job, Webb. You got a thumbs up, Charlie.
I appreciate it.
No, I think you guys did a great
Yeah.
job. There's just always some more questions. Yeah, it is.
So if I can speak to next steps. When we get the final report from the gentleman from Via Mobility, we'll be sharing and that will be going to county planning because that's the contract that you have is with the county through county planning. We'll get a copy of that as well. We'll reconvene that first of all, before I get to that, we'll get that report. Our friends at Delhi Telephone have been reporting this, so we'll put this on Delhi Tel on Local 1, as well as on Catskill through Margaretville Telephone Company. We'll put it on the Chamber's YouTube channel, try to elicit some more public comment on this. We'll get your final report, and then that steering committee will come back together or subset initially to incorporate that into that coordinated transportation plan. Once that is done, that then gets turned over to Wayne and his colleagues at the County Board of Supervisors for review, hopefully adoption, hopefully approval. And if that gets approved at that level, then it goes to New York State Department of Transportation for approval and review. What I expect that we'll be able to do with that plan, though, is outline some very specific first steps that may be taken and potential funding opportunities for those initial pilot. And I want to emphasize initial pilot steps. This is a baby step that we've, today, this has been a baby step. But it's a significant baby step that I hope that we've taken. Thank you all for spending the last hour or so indoors on a beautiful.
Where's lunch out through the hall there?
Wherever your credit card leads to. But thank you all for attending today and stay tuned. If you registered for the event, you'll get a copy of the recording, at least of the Zoom. And when Brittany does her magic and we have something a little bit more polished.